Look at that. That is my splint being taken off shortly after the last video that I made. And oh, it felt so good. It was crazy seeing how much smaller it got. I am now 1 month post distal biceps tendon surgery. Things are moving along pretty well. I think after my first follow up, I was given an adjustable arm brace. Was told to keep the arm at 90 degrees of flexion for a couple weeks, but take it off a few times a day to work on passive range of motion. But for my own safety and to reduce any risks of accidents, I have been wearing the brace whenever I leave the house. So, because I know I'm prone to bumping into things, and having that brace kind of helps me maintain that spatial awareness. So as far as the passive range of motion, as you can see in the video, I'm allowing my arm to open up, and then I'm assisting bringing it back to a flexed position. This was pretty novel right here. First time I'm able to really move my shoulder and kind of work my upper back muscles with a band. Each day though, I've been wearing the brace less and less based on how well I tolerate my arm hanging at my side. But I feel like the training and the cardio has really helped my recovery, and the cross education effect of training my left arm, I think, is evident as I've noticed my injured side fill out a little bit since getting that splint removed. So I should be clear to start physical therapy soon after my second checkup, which is about a week from the recording of this video. This is a good little bird dog variation. Reaching out, kind of activating my trap 3 muscles and getting my rear delt back in the mix with that external rotation, but not using the biceps at all because that shit hurts. Definitely takes a lot out of me because the nerve pain is nuts, and I'll get to that in a minute. Adjacent to all of this, though, I've started a health optimization protocol through Merrick Health. I've had a lot of time to reflect on where I want to take my fitness over the last year. I enjoy the many different expressions of my physicality, and I always have throughout my life. You got the powerlifting, strongman, mountain biking, obviously, even trail running. Yes, at 225 pounds, I still enjoy running to an extent. And obviously, I still have to stay in shape in the military. But I consider myself pretty healthy, and I'd like to keep it that way. I've never gotten like a full comprehensive blood panel done. I've never gotten like my heart looked at or anything. And my dad was adopted. I don't know anything about his health history, his side of the family. Neither does he. He was adopted at a very, very early age. My mom's side, has got diabetes, high blood pressure, and all that. So, anyways, the annual blood work that I do get done through the VA is a little limited, and all I can gather is that I'm healthy enough compared to the general population. They aren't necessarily in the business of optimization. Just seeing that vets are within normative ranges of general health. As long as you're doing better than a 70-year-old man with cancer, you're good. You're in the green. See you next year. High five. So anyways, back to Merrick Health. They're a telehealth platform. They operate outside of the insurance networks, and therefore they are not constrained by them when it comes to personalizing treatment options. Working with them has allowed me to really take my health and wellness in my own hands, and I couldn't be more excited going forward with this. I honestly should have probably done this 5 to 10 years ago. I have an awesome patient care coordinator who's been extremely helpful every step of the way, from getting my first complete blood panel and guiding me through treatment options based on my health markers and fitness goals. So for anyone who's fed up with our current healthcare system and they want to take more control of their well-being and have more oversight and really understand what's going on underneath the hood, I highly recommend setting up a consult with Merrick Health. So I'll put that link down below. Check them out. I'm not sponsored by them. I'm just super excited because I still have goals. I still want to move mountains, you know? So that's kind of where I am now. It feels pretty good, getting back to somewhat normal life. I'm noticing little improvements each day. Like I can brush my teeth and shave with my right hand now. I can prepare meals a little bit easier. I can put on clothes. Tying my shoes is still a little bit of a pain due to like nerve pain. There's a nerve that goes right along the outside of the forearm, and it gets ret during this type of surgery, and that's going to take maybe a few months before it starts to calm down and, like, you know, repair itself. Next video I make, I'll go over more specific rehab protocols, since I will more than likely be going through physical therapy and starting to regain more active range of motion and maybe some strength back too. That wraps it up for now. See you in the next one. Stay strong, live long.